Welcome to part 3 of the growth and development series here. In section 3, we are going to be looking at sociocultural and humanistic theories. So, how environment, relationships, and basic needs affect development. All right, so these theories focus less on what's happening inside the brain and more on how environment, culture, and relationships shape development. This is really important for nursing because patients don't exist in a vacuum. Their family, culture, finances, education, and environment all affect their health. Now, HESI tip: if a question mentions family influence, culture, language, or environment, think sociocultural theory. Now, Lev Vygotsky, and I apologize, there's a good chance I am mispronouncing that last name, but believed that learning is a social process. According to this theory, people learn best through interaction with others, especially someone who is more knowledgeable, like a parent, teacher, or healthcare provider. He introduced the concept of the zone of proximal development, which is basically the gap between what a person can do on their own and what they can do with help. So, if a question describes learning with guidance, coaching, or support, that's Vygotsky. Now, as nurses, we work in this zone all the time, okay? This zone of proximal development. When we teach a patient how to give insulin, use an inhaler, or care for a wound, they may not be able to do it independently at first. So, with demonstration, coaching, and practice, they move from needing help to doing it on their own. That's the zone of proximal development in action. Next is Yuri Brofenbrenner, who looked at development through the lens of environmental systems. He believed development is influenced by layers of environment, starting with immediate surroundings like family, and expanding outwards to schools, communities, culture, and society. Things like poverty, access to healthcare, education level, and social support all affect development and health outcomes. This theory reminds us not to blame patients for circumstances outside their control. If a patient struggles with medication adherence, it might not be noncompliance. It could be transportation issues, financial barriers, or lack of education. As nurses, we look at the whole picture, not just the symptom. So, another HESI tip for you: questions involving social determinants of health, think Brofenbrenner. Now let's talk about humanistic theories, which focus on personal growth, motivation, and human potential. These theories are extremely relevant to nursing because they emphasize respect, dignity, and patient-centered care. You already know Maslow's hierarchy of needs, and yes, it will be on HESI questions. Maslow believed that basic needs must be met before higher level needs can be addressed. At the bottom are physiological needs like oxygen, food, water, and sleep. Okay, and remember those first physiological needs that we need to think of? What are they? You got it. ABCs: airway, breathing, and circulation. Then come safety needs, followed by love and belonging, esteem, and finally self actualization. So, if a patient can't breathe, is in pain, or is unstable, physiological needs come first, always. Okay. Now, this is where Maslow's becomes very practical. Let's say a patient who is hypoxic, in severe pain, or actively bleeding is not ready to talk about lifestyle changes or emotional growth, for instance. We must meet basic survival needs first, then move up the hierarchy. So, a healthy strategy with this is if you're stuck between answers, choose the one that meets the lowest unmet need. Carl Rogers. Now, Carl Rogers believed that people have an innate drive to grow and improve. He emphasized the importance of unconditional positive regard, which means accepting people without judgment. In healthcare, this translates to creating a safe, supportive environment where patients feel heard, respected, and empowered. Rogers' theory is the foundation of therapeutic communication. When patients feel respected and understood, they're more likely to be honest, participate in care, and follow treatment plans. This is why empathy, active listening, and non judgmental communication are essential nursing skills. So, if a question that you see focuses on therapeutic communication, who are you going to think? Bingo, Rogers. Okay, now when we combine these theories that we've talked about so far, we get a powerful nursing approach. We consider the patient's environment, culture, support systems, and basic needs, while also treating them as a whole person with goals, values, and potential. This is what patient centered care really looks like. So, your high yield takeaways. Okay. Vygotsky, think learning with support. Brofenbrenner, think environment matters. Maslow, basic needs first. And Rogers, therapeutic communication and respect. Nursing care must address the whole person. All right, thank you for joining me for section 3. Next up is going to be section 4, where we are going to be talking about behaviorist and social learning theories. I'll see you in the next one.